Hi, hello, welcome to my channel Form Detox with me Madhu. I am back with an interesting topic. Before going to the video, don't forget to subscribe to my channel and press the bell icon for interesting updates. If you like the video, share to your friends or family members. Today our topic is computer application in community pharmacists. It is a very interesting topic you are going to learn. So let's move into the video. First we are going to learn about the learning objects. What are you are going to learn in this video? Able to know the various computer applications in community pharmacies. You are going to learn in this video is about this topic, computer applications in community pharmacy. First, now we are going to I'm going to say about introduction. Introduction means what is a computer. A computer is a device that can be programmed to carry out a set of arithmetic or logic operations automatically according to the instructions written in a software. A computer is a device. First we have to set a software. According to that software only the computer will be run. Conventionally, a computer consists of at least one processing element, typically central processing unit CPU, and some form of memory. The processing element carries out arithmetic operations in the response to stored information. Use of computers in community pharmacy. What are the use of computers in community pharmacy? Means there is a more and more useful element is computers in community pharmacy because of that maintenance of records and medicational history and drug information, education, analysis, they all can be done with the computers. Next point, they have become indispensable in the development of clinical pharmacy and pharmaceutical management. Indispensable means necessary. Computers have become necessary in the development of clinical pharmacy and pharmaceutical management. And computers are also used for patient profile monitoring, medication database management, and material management of pharmaceutical research. Why computers are important in the field of pharmacy? The computers has become a very common tool in all areas of science and technologies nowadays. Not only in pharmacy, the computers are become a very common in all aspects. uh, Without computer, the software companies they won't run. Laptops or computers is a very useful for their profession. With the proliferation of the internet and the developments in computers technologies and manufacturing, the ratio of the price to perform of the computers has continued to decrease. In nowadays the internet also available to improve our technology of computers and ratio and price. And next one is this has resulted in the development of number of computer applications. Next, basically the use of the computers in pharmacy fields was get started from the year of 1990. Basically in our pharmacy we are thinking that before 5 years or before 10 years they started using the computers, but no. From 1980 onwards, in our pharmaceutical field the computers has been started working. There is a great demand of computers in pharmaceutical fields. Of course, the field of pharmacy has immensely benefited by the use of computers. Before I told in previous slide, there is a more use with computers by storing of patient information, leaflets, and materials. What are the records, financial records and all. So that's why pharmacy have immensely benefited by the use of computers. This will applicable and will continue to benefit as the pharmacist again more familiar with the computer. Pharmacist also can do the works easy with a computer. Some of the important areas where the computer are useful in a new drug discovery, new design, analysis, manufacturing of drugs, and hospital pharmacies. These are These aspects also, the computer is more useful nowadays. Other than these, computers or helps to the pharmacist collaborate with the other professionals, which is essential in the research work. It is also provides solutions, the solutions for the time consuming the manual task. Various hardware and software have been developed without which drug discovery and for designing, manufacturing and analyzing would become virtually impossible. The computers are also used in discovering of a drug or designing of a drug. The most important fact is that will enable is to discover new drugs for the complete care of dangerous disease and reduce the cost of production of the disease which are easily cured. The computers are also useful for the hospital pharmacist and in the telemedicine. A lot has been done, still has to be done for improving the computer facilities for pharmacists. There nowadays we are having a more and more technology in computers, but the improvement of facilities or technology in computers is not at all enough. We have to improve the technology and computer facilities for pharmacists. Here are some important applications of computers in the pharmacy. Next, we are going to know about computer soft. There are what are the applications of computers in pharmacy? There are there are 29 applications of computers in community pharmacy. First one is prescription filling. Patient name, doctor name and drug name, quantity, prescription number, prints the label, calculate the price and discounts. This is a very easy work while giving a prescription. A prescription refilling. Pharmacist enter data regarding the prescription. If data not available, to avoid any warning message appears if the prescription is out of the data. That's it. Next one, third one is e-prescription. E-prescriptions are computers generated prescriptions created by the healthcare provider and sent directly to the pharmacy. E-prescriptions are sent electronically through a private, secure and closed network. This is e-prescriptions is very useful to the prescriber and doctor to a prescriber. And then in e-prescriptions there are four types. E-prescription is qualified into three types or four types. First one is fast. Your prescription arrives to your pharmacy before you leave your doctor office. First one, convenient. You don't have to make that extra trip to drop off your prescription at the pharmacy. The second one, legible. There is no handwritten for the pharmacist to interrupt. Economically, make it easier for the pharmacist and also for your doctor to prescribe the most cost effective medications based on the patient insurance coverage. Next one, fourth, prescription processing. Prescription processing is invariably one of the main activities going on within a pharmacy on a day-to-day basis, and computers are used to make this process more reliable and efficient. Both the customer service side of the pharmacy operations and the dispensing aspect are today carried out through the use of computing systems. Pharmacy computers also handle customer service activities such as sales and cash handling within the retail operations. Patient counseling. Pharmacist can print counseling, hand out a prescription, label and invoice. Also hand out contains an information the patient might need to know regarding precautions or side effects of the medicines. Sixth one is patient profile. Pharmacist can update patient profile whenever a new prescription is filled. Also, if the patient might have any symptoms like allergies, it should be added to the patient's profile. The next one is drug interactions. There is a program regarding this point. This provided from many vendors offers program for drug interaction. The pharmacist must check the patient's profile and prescription to determine if there is an interaction. Eighth one, information. Having access to the web via pharmacy computers is something that has enhanced the ability of pharmacists to carry out their duties to a higher standard, as well as giving the pharmacy staff access to the vast store of information that is available on the internet, including those on the specialist pharmacy resources. Internet connects a pharmacist to their peers on a global scale. Database. Computer database system information about medicines and medical treatment in general are used without pharmacies. 10th one, nursing home reports. Some information must be added by nursing home administrators, including physician order sheet, unit dose filling profile, medication administration records, and consultant pharmacy evaluation. And the 11th one is account receivable. These offer from vendor of computerized data processing. In most systems, the account can be aged may 30 or 60 or days. Pricing formulas. The program is available for select specific formulas for pricing medication. It includes standard structure for pricing, control substance records. These for controlled substance items that ordered during period along with quantities and dosages. Stock movement reports. These depend on how much of drugs taken from previous inventory, and this allowing to the pharmacy manager to minimize the actual inventory investment. Merchandise control reports. These point to know the goods move fast or slow, also provide information for pricing decisions and judges for entire store's performance. Electronic order entry. Now the wholesaler provides for other pharmacies interface with their central computers to order new medications. Also, pharmacies employee takes inventory of the shelf stock using optional scanner to read a record product codes and quantities. 17th one is permanent shelf labels. In addition, wholesaler provides shelf labels containing the product description, item number, size, fine line code, universal product code bars, and other information. Customized price stickers. Wholesalers supply price stickers. Also, sticker include other information, quantity ordered, item number, cost, and data of merchandise order. Daily and monthly log. Computer program can provide a pharmacy with a timely, precise review of prescriptions broken out into prescription number, patient type, gross profit margin, and other information. Management reports. These is a lot of different types of reports can help the pharmacy manager in his practice and his business. These like accounting, payroll, administration, cost and financial analysis, market analysis, budgeting, sales forecasting, and investment analysis. Communication. Computers are used within pharmacies to facilitate communication, from email to other internet based messaging system. Online communication allows pharmacists and other pharmacy staff to keep in contact both within their own organization and within the professional community. Some pharmacy companies have their own internet systems for internal communication over the internet. 22nd one is information. Having access to a web via pharmacy computers is something that has enhanced the ability of pharmacy to carry out their duties to a higher standard, as well as giving the pharmacy staff access to the vast store of information that is available on the internet, including those on specialist pharmacy resources. The internet connects pharmacy to their peers on a global scale. Professional communities for pharmacists operate online, creating an atmosphere that is conducive to professional development. Databases. Computers databases for information about medicines and medical treatment in general are used within pharmacies. These database systems allow pharmacy staff to find out information about any potential conflicts or healthcare problems in a prescribed treatment, as well as information about the details of any particular medicine. The pharmacist needs to know more about these information may include ingredients and potential effects, as well as research and scientific data also. Patient management. Healthcare clinicians and administrators alike are showing enthusiasm from one of the medical field in newest technology trends, a patient information management system. These electronic system serves as a database for storing patient files. Information can be easily added, changed, deleted, printed, or add audited by clicking a few buttons on the computer. Pharmacists do not have to store or carry around health records any longer, because all they need is access to a computer or laptop to pull up patient information. 25th one. Scheduling. When a patient call a pharmacy to make an order, the representative who answered the phone can schedule them through the use of a computer appointment scheduling them like an appointment. These electronic systems allow front office staff to add, delete, or change appointments with the click of a mouse. If there is more than one order, schedules can be sorted by pharmacist as well as be color coded to indicate if it when the order be available. Error prevention. Pharmacy computer systems can help to prevent errors in medication, potentially saving lives and general prescribing the health of pharmacy. Not only the doctors, computers are also save the lives. Why? Because we are setting as a some quantity of drugs or some names of drugs, we are code it and set it in a computer. So if we done any mistake, the computer will say that it is a mistake. It is a so that's why it is very useful in pharmacy profession. As well as checking medicines and combinations of medicines, this system can in some cases check on patient information. The availability of such systems varies across the different geographical areas, but in some cases pharmacy computers are able to check on prescribed medicines with specific reference to a patient and their overall healthcare picture. 27th one. Medical claims. Computer or what health or companies are using to submit, review, process and pay medical claims according to a 2006 article by the Healthcare Financial Management Association. Health technology trends indicate that more and more companies are relying on computers to submit their claims rather than submitting them via hard copy, because computers expedite the process. Information management engineers have created systems and technology tools that make the claim process of medical field more efficient and easy to use. Computer and medical education. Computer have revolutionized the way education is handled in the today's world. In medical education, computers are particularly useful because there is such a need for learning and presenting large amounts of data, getting and comparing accurate study and test results, and effectively monitoring patients. Miscellaneous services. The pharmacy manager can take advantage of numerous miscellaneous services offered by wholesalers. These services include some reports regarding new items, price changes, special offers, and special discounts. Thanks for watching this video, and don't forget to like and comment, and please subscribe to my channel for more. Press the bell icon for more interesting updates.